on. I want to just bring you that story about those 220 resident doctors, about 300 nursing staff of Delhi's MCD-run Hindu Rao hospital who have withdrawn from their duties. They say they haven't been paid for 4 months. They cannot provide for their families' basic needs. The hospital is run by the North Delhi Municipal Corporation. They've been blaming the Delhi government for lack of funds, and the government has been blaming the MCD in return.
COVID warriors on strike. After not being paid for 4 months, over 200 resident doctors of Delhi's Hindu Rao hospital have now withdrawn their services, and so have 300 nursing staff. Of the 23 patients who were admitted in this COVID-dedicated hospital, 20 have been shifted to other hospitals, while 3 critical ones are now being looked after by senior doctors.
It is really tough for us to pay the rent. We have to ask, at this age, we have to ask our parents from home that please lend us some money. After we've been working so hard for so many years, we don't get our salaries, so we ask them.
We have been continuing our protest since 11 and 12 days. You can see that our doctors have been marching in the protest in a silent, symbolic protest manner. And there have been no assurance from either MCD or Delhi government that whether our salary will be released or not. They are saying that you take 1 month, then you call off the protest. Is it worth? We are every time we have to face the same problem.
Hindu Rao Hospital is under the BJP-run North Delhi Municipal Corporation or NDMC. NDMC says that it does not have funds to pay salaries because of the pandemic. They say the Delhi government has not paid them their dues. The Delhi government says the NDMC should hand over the hospital to the government if they can't run it. Both the Delhi government and the NDMC have not responded on the issue since the strike began. Doctors say they want the politics to stop.
We are actually deficient somewhere to give our 100%. We don't want to be a volleyball in this whole AAP and BJP scenario and all the government. We actually don't care which government runs this hospital. We actually come in the morning with the mindset of how many patients I have in the ward that I want to treat and which of them seek my real urgent intervention.
We have seen all grand gestures, from lighting candles to showering flower petals upon our frontline warriors. But they continue to be deprived of their basic right, the salary that they deserve for the hours of work that they put in. In New Delhi, with camera person Sanjay Kaushik, this is Sukirti Dwivedi for NDTV.
All right, so where does the buck stop? Raghav Chadda, to you first.
Look, Sara, I think this is something that everybody who lives in Delhi knows, that Kasturba Gandhi Hospital as well as Hindu Rao Hospital, 2 big hospitals, are run by the MCDs. Yeah. Almost close to 2 decades, the MCDs have been ruled by the Bharatiya Janata Party, and as we speak, the BJP enjoys a very significant majority in Tier 3 of the government, that is the municipal corporations of Delhi. Now, BJP, MCD have various sources of revenue. They collect their own taxes, their property taxes, toll tax, so on and so forth. And one small component of their overall revenue happens to be the money that the government of Delhi needs to give to them as per the Finance Commission. The government of Delhi has paid all its dues. It's an open, it's in public domain. The documents are available and no one can dispute that. Now, irrespective of the fact how much money the MCDs collect, that money doesn't seem to suffice. This is an open secret that MCD today in Delhi, Sara, stands for most corrupt department and not for Municipal Corporation of Delhi, because it is the most corrupt department that one has ever seen. And therefore, they have, to a point where they have siphoned off the money and the resources that they had collected to pay off the salaries of the so-called COVID warriors. Now, you have on one hand, let me just finish you in 15 seconds. Okay. You have on one hand the Bharatiya Janata Party's tallest leader and the country's prime minister running helicopters across the city and showering flower petals on doctors and the medical staff who are at the forefront of this fight against COVID-19. On the other hand, you have the BJP and MCDs that have siphoned off this money and are not willing to pay the salaries. Now, I have a solution to this problem. I'm not only talking of the problem. The solution is hand over this hospital to the government of Delhi and we will run it. We will run it for you. Just hand it over to us. If you can't run it, as simple as that. Let not the people of Delhi suffer because of this.
Mismanagement, corruption, and doctors and nurses paying the price for this.
Well, Sara, just 2 or 3 months back, it was the Supreme Court which had questioned the Delhi government regarding the issue of payment to the COVID warriors, and rather it had put up this statement that the country cannot afford to dissatisfy the soldiers who are fighting the pandemic war.
That was not for Delhi
And
government.
they had, even the High Court had also asked, based on the observation and questioning which was made by the Supreme Court to the Delhi government, that whether it is in terms of the payment, wages payment, or the service conditions of the nurses and of the doctors, and this is not a problem which has just occurred right now, Sarah. In 2018, the resident, nearly 30,000 residents.
Let's talk about the MCD, which is not a problem that's happening right now.
They had said because their payment, 7th pay commission has not been implemented.
But I thought this is a pandemic problem. Why are we saying this was happening since 2018?
Even Delhi
Is this a problem that they're not getting paid because of the pandemic? Let me get in Dr. Sagardeep Singh. Raghav, I'll let you respond, but I want to just bring in the doctors because they're the ones who are most affected. Dr. Sagardeep Singh, Vice President of the RDA, Hindu Rao Hospital. What's happening now on the ground? These doctors are will be terminated, or what do you expect? Both the AAP and the MCD passing the buck over here?
Yeah, ma'am, a very good evening. As you've listened, Mr. Raghav Chadha, he just said that, it's because of the BJP run MCD, they're not able to pay, it's a corrupt body or whatever it is. We don't want to become a part of their political football, right? So we are doctors, we are not public demonstrators. And all we want is that if we have given our services that and we have been working day one since of this pandemic, but we haven't been paid from the last 4 months. So someone has to be responsible for it, and pay the healthcare workers. We are very proudly we say that India has a very the recovery rate of COVID is very high, the mortality rate is very low, the hospital admission rate is coming down, but now you have to really have to appreciate your healthcare workers who have been working day in and night.
Yes, Dr. Bava, is this the first time? Is it only a coronavirus pandemic lockdown related situation that you haven't been paid?
No, ma'am. No, ma'am. There has been irregular of salaries in our institute throughout.
No, so that means for years. So if the MCD is saying this has got nothing to, this has to do because of the coronavirus pandemic, that they're not getting parking fees, that they're not getting property taxes. You're saying that's not true. You were not getting paid even before. You were getting paid irregularly.
Yeah, it's the problem has been irregular, and the problem has
been
worsened
because of COVID. Richest civic bodies in the country. Raghav Chadha, please quickly respond to what Geeta said.
Yes, this is an annual affair, Sarah. It has nothing to do with COVID-19, number one. Number two, I absolutely shudder to think that it is not just about the financial compensation. Just imagine how much damage the BJP has caused to the morale and the motivation levels of our healthcare workers, number one. Number two, regarding the High Court and the Supreme Court that was being quoted allegedly, certain statements were attributed to the Honorable High Court and Supreme Court by the BJP spokesperson. Let me make this very clear that certain verbal inquiries were made by the Supreme Court. Those verbal inquiries were addressed by the Council of the Government of NCT of Delhi. There was no stricture, there was no notice issued, there was no judgment passed against the Government of Delhi because our books are clean and we've paid our dues. Number two, it actually boils down to the political will and the administrative will to run the hospitals. Now, you don't see a similar problem in Delhi government-run hospitals or any government-run hospitals. You see this only in MCDs because Bharatiya Janata Party has thoroughly corrupted the institution. And MCDs, I have no shame in saying today stands for the most corrupt
I think you're right. We can all agree this shows the priorities of our governments and the doctors paying the price on the ground. Thank you all. And the irony is that now that these doctors have gone on strike, patients have to be shifted out of this hospital. It means the number of bed capacity reduces to fine. Dr. Bava, quick, I'm out of time. 30 seconds to you. Closing words.
I would like to state that we are not on strike. See, we want to work and we are willing to work. And we have just withdrawn our services because it's been 4 months that we've given our services. Yeah,
I don't know if any one of us could survive not being paid our salaries for 4 months.
Exactly. So I would like you to refrain the word strike. We are not on strike. I
You've
want to work
withdrawn your
tomorrow as
services.
well.
All right. All right.
Exactly.
Thank you all. Thank you, Dr. Bava, especially for joining us.